The unseen choice: why your blood pressure pill could be shaping your life without you knowing it. Every single day, millions of Americans embark on a silent journey, trusting a tiny pill to safeguard their heart health and extend their lives. If you or someone you cherish is among the countless individuals navigating the challenges of high blood pressure, you're likely taking one of two exceptionally common medications, amlodipine or losartan. Both are powerful defenders against the silent killer that is hypertension, yet beneath their shared purpose lies a profound, often overlooked difference. What if the very treatment you rely on daily carries subtle yet significant side effects that could quietly diminish your quality of life? What if choosing the wrong one, or not fully understanding its impact, could lead to persistent discomfort, unexpected complications, or even a critical health event that could have been avoided? This isn't just about managing numbers, it's about making an informed decision for your everyday well-being, a choice so vital you simply cannot afford to miss this crucial information. Before we delve into this critical comparison, it's essential to understand that everything presented here is meticulously grounded in robust research from highly respected medical institutions. Our insights draw directly from trusted sources like the Mayo Clinic, Cleveland Clinic, the NHS, and the FDA, with all references available for your review. Please remember, this comprehensive guide is designed purely for educational purposes, to empower you with knowledge. It is not and should never be a substitute for professional medical advice. Your unique health situation warrants a personalized discussion with your own doctor, who remains your most trusted partner in making any health decisions. Today, we're going to demystify how amlodipine and losartan operate within your body, meticulously examine the specific side effects you absolutely need to monitor, and ultimately reveal which drug tends to present more challenges in real-world scenarios. Amlodipine, the widely trusted arterial relaxer. Let's begin our exploration with amlodipine, a medication that stands as one of the most frequently prescribed blood pressure treatments across the United States. Its prevalence is staggering. According to the renowned Mayo Clinic, physicians issue tens of millions of prescriptions for amlodipine annually. It has firmly established itself as a go-to choice, particularly for older adults and those who have recently received a diagnosis of high blood pressure. Amlodipine belongs to an important class of drugs known as calcium channel blockers. While that name might sound a bit technical, the underlying principle is remarkably straightforward. Normally, calcium plays a crucial role in helping the tiny muscles within your arteries contract and tighten. When amlodipine enters the picture, it effectively blocks calcium from entering these muscle cells. Without this calcium influx, these arterial muscles relax, allowing the blood vessels to widen. This vital relaxation enables blood to flow through your system much more freely and smoothly, significantly reducing the demanding workload placed upon your heart. The therapeutic reach of amlodipine extends beyond just high blood pressure. Doctors also frequently prescribe it for individuals experiencing chest pain, a condition medically termed angina, often associated with coronary artery disease. In these cases, the arteries that supply essential blood to the heart muscle can become alarmingly narrowed. Amlodipine steps in to help keep these vital vessels open and expansive, ensuring that more oxygen-rich blood can reach the heart. This action plays a pivotal role in alleviating chest pain during daily activities, allowing patients to maintain a more active and comfortable lifestyle. Leading medical organizations, including the American College of Cardiology and the American Heart Association, wholeheartedly endorse amlodipine as a premier first-line treatment option, especially for individuals over the age of 55. It has demonstrated exceptional effectiveness in specific demographics, such as older adults and African American patients, often proving superior to certain other blood pressure medications in these groups. So, precisely how effective is amlodipine in its primary mission? Clinical trials consistently reveal that amlodipine lowers blood pressure in a remarkably reliable and predictable manner. In one particularly large and impactful study, patients who were taking amlodipine experienced an average drop of approximately 16 points in their systolic blood pressure. That's the crucial top number you see on a blood pressure reading. For context, losartan, which we will examine in detail shortly, typically reduced systolic pressure by around 14 points in similar studies. While a 2-point difference might seem marginal at first glance, its implications are monumental. Even such a seemingly small average reduction, when applied across millions of people, can translate into thousands fewer strokes and heart attacks occurring each year. This compelling evidence is precisely why doctors view amlodipine as an exceptionally powerful and indispensable tool in the fight against high blood pressure. However, the numbers displayed on a blood pressure monitor, while important, represent only one facet of a patient's overall well-being. How you genuinely feel from day to day, your daily comfort, energy levels, and ability to engage in life matters just as profoundly. And it is here, in the realm of everyday experience, that side effects become a critical consideration. The most widely reported and often bothersome issue associated with amlodipine is the occurrence of swelling in the feet and ankles, a condition doctors refer to as bilateral edema. This happens because amlodipine expertly relaxes the arteries responsible for carrying blood away from the heart. However, the veins, which are tasked with returning blood to the heart, do not relax in the same manner. This physiological imbalance allows blood and fluid to gradually accumulate and pool in the lower legs. Over time, this excess fluid can begin to leak into the surrounding tissues, causing your ankles to visibly swell. If you've ever found your shoes feeling noticeably tighter by the end of the day, even without any change in your weight, this familiar sensation could very well be a sign of amlodipine-induced edema. The Cleveland Clinic reports that roughly 1 in 10 individuals taking a standard 10 milligram dose of amlodipine will experience this swelling. It is more prevalent in women, and the risk incrementally increases with higher dosages or prolonged use of the medication. Dizziness presents another frequent complaint among amlodipine users. This sensation often arises due to orthostatic hypertension, a sudden and noticeable drop in blood pressure that occurs when you transition quickly from a sitting or lying position to standing. Patients often describe feeling lightheaded, a bit unsteady, or even momentarily unbalanced for a few seconds, particularly noticeable first thing in the morning. Fatigue is also a commonly reported side effect. Some patients express feeling unusually tired, even when their sleep patterns remain consistent. Others characterize it as a pervasive sluggishness, making even routine daily activities feel like an uphill battle. Less frequently, amlodipine can induce mild nausea, general stomach discomfort, or a tendency towards daytime drowsiness. While most of these effects are not immediately life-threatening, they can significantly interfere with daily comfort and overall quality of life. It's not at all uncommon for patients to discuss these persistent symptoms with their doctors, often leading to a dose adjustment or a complete switch to a different medication. When we consider amlodipine's overall profile, it emerges as both a robust and remarkably reliable medication. It consistently delivers on its promise to lower blood pressure, and for a great many individuals, it performs this vital task without any significant issues. However, it undeniably carries a higher propensity for causing ankle swelling, episodes of dizziness, and general tiredness compared to some other available options. Crucially, the likelihood of these side effects increases with higher dosages. Doctors carefully weigh these factors when making prescribing decisions. Sometimes, the solution is as straightforward as reducing the dosage. In other instances, combining amlodipine with a diuretic, a medication that helps the body shed excess fluid, can effectively mitigate swelling. And, when side effects persist and remain troublesome, exploring a different class of blood pressure medication altogether may indeed be the most beneficial course of action. So, in summary, amlodipine is an effective, widely trusted and often first-choice treatment, But for some patients, its benefits can be overshadowed by bothersome ankle swelling or a pervasive feeling of fatigue. Now, let's pivot our attention to losartan and see how its unique characteristics and side effect profile compare. Losartan, the kidney protector and angiotensin blocker. Moving on, we now turn our focus to losartan, a member of a different yet equally important family of medications known as angiotensin receptor blockers, or ARBs. These drugs employ a distinct mechanism of action compared to calcium channel blockers like amlodipine. Rather than directly relaxing the arteries, losartan works by blocking the specific actions of a powerful natural hormone called angiotensin type 2. This hormone normally plays a dual role. It constricts blood vessels, making them narrower, and it signals the body to retain salt and water. By expertly blocking the effects of angiotensin 2, losartan ensures that blood vessels remain more relaxed and open. Simultaneously, it encourages the kidneys to expel excess fluid and salt. The combined result is a significant reduction in blood pressure and a decreased strain on the heart, promoting healthier cardiovascular function. Doctors frequently prescribe losartan not only for the management of high blood pressure, but also for a particularly vital patient demographic: individuals with type 2 diabetes who are also experiencing kidney disease. This is where losartan truly shines, as blocking angiotensin 2 offers critical protection to the kidneys from long-term damage. For patients grappling with both high blood pressure and diabetes, losartan can act as a remarkably efficient 2-for-1 treatment, simultaneously lowering blood pressure and actively slowing the progression of kidney problems. It also finds application in treating certain patients with heart failure. By effectively reducing the pressure within the heart and its associated blood vessels, losartan empowers the heart to pump more efficiently, significantly improving overall cardiac performance. So how effective is losartan in its role of lowering blood pressure? Extensive clinical studies have demonstrated that losartan typically lowers systolic pressure, that all-important top number, by an average of about 14 points. While this is a slightly smaller reduction compared to amlodipine's average of 16 points, it still represents a substantial and clinically meaningful drop. Even a 10-point reduction in systolic pressure can dramatically decrease the risk of stroke and heart attack by 20% to 30%. Therefore, in practical real-world terms, losartan is an exceptionally effective medication in preventing the major, life-threatening complications associated with high blood pressure. Where losartan truly distinguishes itself from amlodipine is in its unique side effect profile. While amlodipine is notorious for causing ankle swelling, losartan tends to be much gentler on the legs. In fact, swelling in the feet and ankles is a rare occurrence with losartan. This characteristic makes it an excellent and often preferred alternative for patients who simply cannot tolerate amlodipine due to persistent fluid retention. However, losartan has its own distinct set of side effects that every patient should be aware of. The most well-known of these is a persistent dry cough. This occurs because blocking the angiotensin pathway can subtly affect certain enzymes in the lungs. When this delicate enzyme activity is disrupted, it can lead to a constant tickle or an irritating sensation in the throat. For some patients, this cough is merely a minor annoyance. For others, it can be disruptive enough to interfere with sleep and daily conversations. Not every individual develops this cough, but when it does appear, switching to an entirely different medication is often the only effective solution. Another, albeit rare yet potentially very serious side effect of losartan is angioedema. This involves the sudden and alarming swelling of the lips, tongue, face, or even the throat. While it doesn't happen often, when angioedema does occur, it can rapidly become life-threatening by obstructing the airway. Patients who experience any symptoms of angioedema must discontinue the drug immediately and seek emergency medical attention without delay. The risk of this severe reaction is somewhat higher in patients who have previously experienced similar reactions to ACE inhibitors, another class of blood pressure medications. Dizziness is also a possible side effect, as losartan effectively lowers blood pressure. Some patients may feel lightheaded, particularly when they stand up quickly. This is also linked to orthostatic hypotension, a sudden drop in blood pressure that accompanies changes in posture. This sensation usually improves as the body gradually adjusts to the medication, but it can be particularly troublesome for older adults who are already at a heightened risk of falls. Fatigue is occasionally reported, with some individuals describing feeling a bit more tired than usual, though this is often mild. Mild stomach upset, including symptoms like nausea, heartburn, or abdominal discomfort, can also occur. In the vast majority of cases, these effects are temporary and tend to fade with continued use of the medication. On the positive side, losartan boasts several unique and compelling benefits. As mentioned, it provides crucial protection to the kidneys in individuals with diabetes, a benefit consistently confirmed by extensive studies supported by the National Institutes of Health. It also demonstrably reduces the risk of stroke in certain high-risk patient populations. Moreover, unlike some other blood pressure medications, losartan typically does not cause problems with blood sugar levels or cholesterol, making it a favorable choice for patients with metabolic concerns. When we take a holistic view, losartan is widely regarded as one of the most well-tolerated blood pressure drugs currently available. It is significantly less likely than amlodipine to cause leg swelling and also less likely than older ACE inhibitors to trigger a severe cough or angioedema. Nevertheless, no medication is entirely free of potential side effects, and patients must remain vigilant for any new symptoms that may emerge after starting losartan. Doctors typically make the crucial decision between amlodipine and losartan by meticulously evaluating the entire patient profile. If ankle swelling is already a problematic issue, losartan may be the preferred choice. If kidney protection is a top priority, especially in a patient with diabetes, losartan is often the first and best option. Conversely, if rapid and exceptionally strong blood pressure control is immediately needed, amlodipine may be considered the more powerful and direct option. To summarize, losartan effectively lowers blood pressure, provides vital kidney protection, and is generally very well tolerated. Its most common drawback is the characteristic dry cough, and in exceedingly rare instances, angioedema. But overall, it stands as a safe and highly effective long-term treatment for countless individuals living with high blood pressure. Next, we will synthesize all this information, directly comparing amlodipine and losartan to give you a crystal clear understanding of where each one truly excels. A direct showdown, amlodipine versus losartan. We have now meticulously examined both amlodipine and losartan, delving into their mechanisms, benefits, and distinct side effect profiles. Both medications are extensively prescribed, undeniably effective, and possess the power to save lives by combating the dangers of high blood pressure. However, when we place them side by side for a direct comparison, their subtle but critical differences become strikingly clear, influencing millions of individual treatment pathways. Let's begin by evaluating their sheer strength in lowering blood pressure. Amlodipine, as a calcium channel blocker, acts by directly relaxing the arteries. Clinical trials consistently demonstrate that it achieves an average reduction of approximately 16 points in systolic blood pressure. Losartan, an angiotensin receptor blocker, works differently to achieve a reduction of around 14 points. While a mere 2-point difference might initially seem insignificant, remember that in the realm of cardiovascular health, every single point matters. This seemingly small average gap, when extrapolated across millions of patients, translates into thousands fewer strokes and heart attacks averted annually. Therefore, in terms of raw, potent blood pressure control, amlodipine does hold a slight yet meaningful edge. However, simply lowering blood pressure represents only half of the comprehensive treatment story. The other, equally vital half centers on tolerability, that is, how comfortably and effectively patients can live with their medication on a daily basis, and it is precisely here that the paths of these two medications notably diverge. With amlodipine, the most prevalent and often frustrating complaint is the aforementioned swelling in the feet and ankles. Approximately 1 in 10 patients receiving a standard dose will experience this issue. For some, it manifests as a mild inconvenience. Perhaps shoes feel a bit snugger by evening. For others, however, it can escalate into a source of significant discomfort, frustration, and even discouragement. Dizziness, general fatigue, and occasionally mild nausea or drowsiness are also known to occur. The higher the dosage, the greater the likelihood and potential severity of these effects. Losartan, conversely, is significantly less likely to induce swelling. This characteristic makes it a highly attractive option for patients who already grapple with edema or for older adults who are particularly concerned about circulatory issues. However, losartan comes with its own set of trade-offs. A persistent, dry cough stands as its most common distinguishing side effect. While not every patient will develop it, when this cough does appear, it can be surprisingly difficult to ignore and often quite bothersome. Another rare, but exceedingly serious risk associated with losartan is angioedema, the sudden and alarming swelling of the lips, face, or throat. While infrequent, when angioedema occurs, it represents a medical emergency demanding immediate care due to its potential to obstruct airways. So, ultimately, which drug is better or worse? The truth, as often is the case in medicine, is that it fundamentally depends on the individual patient. No two people will respond in precisely the same way. Doctors meticulously consider the entire clinical picture before making a prescribing decision. For instance, if a patient is already experiencing kidney disease due to diabetes, losartan might be the unequivocally superior choice. This is because it not only effectively lowers blood pressure, but also provides crucial long-term protection for the kidneys. If a patient presents with angina, chest pain, or requires immediate, robust blood pressure control, amlodipine might be the preferred and more direct option. If swelling in the ankles is already a concern or a barrier to treatment, losartan is often a much safer and more tolerable choice. Conversely, if a patient has a history of severe allergic reactions, doctors may opt to avoid losartan and select an entirely different class of medication. In current medical practice, doctors sometimes even combine these two powerful agents. Pairing a calcium channel blocker like amlodipine with an angiotensin receptor blocker like losartan can provide exceptionally strong blood pressure control while simultaneously helping to balance out or mitigate some of the individual side effects. However, such a nuanced decision can only be made by a qualified healthcare provider, taking into account the patient's complete health history and existing medication regimen. The single most important takeaway from this comprehensive comparison is this: both amlodipine and losartan can be outstanding and life-saving choices for managing high blood pressure, but neither medication is entirely perfect or universally ideal. Amlodipine is highly potent, but carries a noticeably higher risk of swelling. Losartan is generally gentler on the legs, but brings with it the risk of a persistent cough and, in very rare instances, the serious threat of angioedema. The truly right choice is a deeply personal one, contingent upon your unique body chemistry, your specific health conditions, and the expert judgment of your trusted doctor. Your path forward. Actionable steps for your health. What specific actions should you take if you are currently on one of these medications? Firstly, and perhaps most critically, never stop taking your medication suddenly or without explicit medical guidance. High blood pressure rightfully earned its ominous moniker, the silent killer, because it can quietly, relentlessly damage your arteries for years without obvious symptoms. Abruptly discontinuing your medication on your own could dangerously elevate your risk of suffering a stroke or heart attack, with potentially devastating consequences. Secondly, cultivate a heightened awareness of your body. If you start to notice new or worsening symptoms such as swollen ankles, unusual or unexplained fatigue, persistent dizziness, or a nagging dry cough, make it an absolute priority to discuss these with your doctor immediately. These are not trivial concerns, they are real side effects, and your doctor possesses the expertise to make adjustments, whether it's changing your dosage, adding a complementary medication, or exploring an alternative treatment that can significantly improve your comfort and well-being. Thirdly, embrace consistency. Blood pressure medications work most effectively when they are taken at the same time every single day. Missing doses disrupts the steady presence of the drug in your system, preventing you from receiving its full protective benefits and potentially causing your blood pressure numbers to fluctuate wildly, which is detrimental to your cardiovascular health. And finally, always remember the broader picture. Your lifestyle choices are paramount. Eating less. Sodium, staying physically active on a regular basis, completely avoiding smoking, and maintaining a healthy body weight are all incredibly powerful strategies that can significantly enhance the effectiveness of your medication. In some cases, a sustained commitment to these healthy habits may even allow your doctor to reduce the amount of medication you need over time. We have now thoroughly compared amlodipine and losartan. Both are indispensable tools for lowering blood pressure, and both undeniably have the potential to be life-saving. Yet, their distinct side effect profiles mean that the experience of taking each can be profoundly different. If you or someone you care about is currently taking one of these medications, understanding what to watch for and knowing when to communicate with your doctor could genuinely make all the difference in achieving optimal health and comfort. Stay informed, stay healthy, and always keep the lines of communication open with your healthcare provider.